Millions of individuals in North America are being advised to wear N95 masks when outdoors due to the poor air quality resulting from intense wildfires in Canada. To address this situation, New York has initiated the distribution of free masks, and Canada has recommended mask usage for individuals unable to remain indoors. The smog is anticipated to extend beyond New York, affecting other East Coast regions. Officials have cautioned that the hazardous smoky conditions are expected to persist throughout the weekend. Several cities in the United States, including Philadelphia and parts of Pennsylvania, woke up to hazardous air quality conditions on Thursday. Additionally, large portions of the Midwest and the South are also under air quality alerts. The majority of the smoke originates from Quebec, where 150 fires are currently burning, marking the worst fire season on record for the region. Welcome to Slant News. If you want to support, you can subscribe to our channel. Governor Kathy Hochul of New York has announced the distribution of 1 million masks to residents on Thursday. She emphasized that this situation is temporary and not related to COVID-19. The governor also assured the public that New York City buses and trains have high-quality air filtration systems, ensuring safe transportation. Reports from tourists and residents in New York City have described the weather as causing itchy and watery eyes, with an odor resembling a barbecue. Environment Canada has stated that conditions in Toronto are worsening, with increasing smoke influx. The agency has recommended that individuals wear masks when outdoors, as fine particles in the smoke pose the greatest health risk. However, respirators do not reduce exposure to the gases present in wildfire smoke. New York City has experienced an orange haze covering the skyline, obscuring landmarks such as the Statue of Liberty. According to Swiss air quality company IQ Air, the city had the worst air quality among major metropolitan areas on Wednesday. In response to the situation, zoos have moved animals indoors, and carriage horse rides have been suspended. Public health officials have advised against outdoor exercise and have urged people to minimize their exposure to the smoke due to immediate and long-term health risks. Canadian officials warn that the country is heading towards its most severe wildfire season on record. The increased risk of wildfires is attributed to climate change, which leads to hot and dry weather conditions. Global temperatures have already risen by approximately 1.2 degrees Celsius since the start of the industrial era, and further increases can only be mitigated through significant emissions reductions by governments worldwide. Exposure to wildfire smoke can result in various health issues, according to experts. Professor Matthew Adams, the director of the Centre of Urban Environments at the University of Toronto, explains that immediate effects of inhaling wildfire smoke include shortness of breath, elevated pulse, chest pain, and inflammation in the eyes, nose, and throat. Visits to hospitals tend to increase on days with heightened air pollution, particularly among individuals with pre-existing respiratory conditions. Wildfire smoke is also linked to serious long-term health problems like cancer and lung disease, especially for individuals residing in fire-prone areas. Small particles in the smoke haze can enter the bloodstream and other parts of the body, potentially causing DNA mutations and other health complications. Professor Adams advises limiting outdoor exercise to avoid breathing in the smoke and suggests wearing an N95 mask in areas closer to the fires to minimize the inhalation of smoke particles.